Excellency, the President of the United Nations General Assembly, Mr. Volkan Bozkir. Excellency, the Secretary General of the United Nations, Mr. Antonio Guterres. Excellencies, distinguished delegates. It is my great honor to deliver a statement to the United Nations High-Level Meeting on HIV and AIDS on behalf of ASEAN Health Sector. Mr. President, Excellencies, ASEAN reaffirms our long-standing commitment to curbing the rate of new HIV infections and AIDS-related deaths. This was reiterated through the 2015 ASEAN Declarations to end the AIDS epidemic by 2030, through reducing new HIV infections and AIDS-related deaths and eliminating HIV-related stigma and discriminations. After 5 years, progress towards ending AIDS in ASEAN has been uneven. 4 countries have been making significant progress in reaching AIDS epidemic control, and 6 others seeing increases in new infections among youth people and people living with or at risk of and affected by HIV. This situation has resulted in growing burdens of illness and death, which exacerbated the existing inequalities and further contributing to the negative socio-economic impacts. ASEAN is aware that inequalities in our societies have contributed to the uneven progress in achieving global 2020 HIV targets in our region. For this reason, we welcome the new Global AIDS Strategy 2021-2026 to end inequalities and end AIDS. The strategy provides ASEAN member states with the guidance to re-energize national strategies according to national legislation, priorities, and evidence about the epidemic in each member state and in line with new global targets and minimum standards. Mr. President, Excellencies, we recognize that getting back on track towards ending AIDS by 2030 in ASEAN requires commitment to maximizing equitable and equal access to HIV services and solutions. This means infusing new energy, accepting innovations, addressing co-infections such as tuberculosis and multi-drug resistant tuberculosis, strengthening people-centered services and community-delivered HIV services such as pre-exposure prophylaxis, community-based screening and self-testing, as well as strengthening efficiency in service delivery and improving security of commodities. We further recognize that getting back on track must involve breaking down barriers, which requires better policy and legal strategies design, taking into consideration religious and socio-cultural aspects. We must also improve the resourcing to be efficient and sustainable, integrated into our health systems and social protection, as well as adaptable to humanitarian settings and pandemic responses. We, the ASEAN health sector, must maximize equal and equitable access to HIV services and solutions by ensuring that the communities most affected by HIV are involved and taking leadership roles where possible in our HIV responses, using the highest quality data and strategic information. We understand that a new global pandemic has complicated our work. The intersecting HIV and COVID-19 pandemics have contributed to slowing or reversing HIV response gains in some ASEAN member states. We must step up to the challenge of ending both as public health threats. Mr. President, Excellencies, as ASEAN Health Sector Chair, I stand before you to reaffirm our commitment through regional health response mechanism in ending AIDS by 2030. This is indeed possible with the knowledge and tools available to us. Mr. President, Excellencies, on this occasion, allow me also to highlight Indonesia's views in my capacity as Minister of Health of Indonesia. Indonesia is committed to accelerate efforts to end this forgotten pandemic by 2030 by securing HIV vaccine, therapeutics, diagnostic, and commodity. For that purpose, countries must enhance solidarity in narrowing resources gaps to control HIV and other public health threats to achieve the Sustainable Development Goals. Current development on effort to combat pandemic of COVID-19 through the proposal of waiver of certain IP rights to vaccine, therapeutics, and diagnostic is a reflection of promoting solidarity and effort to combat pandemic. I do hope that we always be open if the waiver certain IP rights be used to the effort in combating the HIV AIDS in the future, whenever necessary, as also reflection of solidarity and common effort to solve and to end the forgotten pandemic. I thank you.